Welcome to the fifth and final video of the Data to Impact series for the Twin Counties Partnership for Healthier Communities. My name is John Wallace, and with me is my colleague Matt Simone. In this session, we will discuss using the Community Survey Data Workbook to obtain data and figures to inform community health initiatives. The purpose of this final session is to introduce the Community Health Survey Data Workbook. It contains tables and figures of all the findings of the Community Health Survey and can be used as a reference and as a tool to provide the data or evidence in support of various community interventions. You can refer to the previous videos for more understanding of the Community Health Survey, but briefly, it was designed with feedback and input from the work groups of the Twin Counties Partnership and conducted in 2017. There were over 320 residents interviewed from both Nash and Edgecombe counties, and the areas and residents were randomly selected such that the results are representative of both counties. The workbook can be found on the partnership webpage and is available to download and free to use. The workbook starts with a table of contents, followed by some introductory text about the survey and using the workbook. Then all of the results from the survey are presented on each tab in the file. At the end of the workbook are two appendices, one which provides a hard copy of the survey to see how questions were asked and designed, and the other appendix shows how closely the demographics of the survey align with the demographics of the Twin Counties. In terms of navigating the workbook, it can be very overwhelming to see all the tabs on the Excel file. And if you have worked with Excel before, it can be difficult to navigate through all the tabs this way. So what we have created in the table of contents are hyperlinks for each question, where if you click on that link, it will take you to that tab with the accompanying question. On each page, you will also see a hyperlink to go back to the table of contents. We strongly recommend this navigation. It makes jumping around the workbook much more efficient. The alternative method of navigating through the workbook is using the tabs, as I just mentioned. They are found along the bottom of the spreadsheet, and clicking on each one will take you to that page. However, there are more than 50 tabs, so it can be a lot to click through. So what is in the workbook? As I mentioned earlier, lots of data and lots of figures, but there's a standard format to keep things consistent throughout the workbook. In the top left of each page, the data are presented in tabular format. Some people prefer to read through tables rather than look at figures, so we have provided both. In the tables, the first section contains the combined results from the Twin Counties, and the question responses, counter responses, and weighted percentages are provided. We also provide the confidence intervals to be transparent about the uncertainty of a given estimate. Think of these as a margin of error, plus or minus a given value. In the far right of the table, we include the error bar calculations, which is the confidence limit subtracted from the weighted percent, which we use to create the error bars for the graphs. Below the combined results, you then see the county-specific estimates for Nash and Edgecombe counties. And if you are a more visual person and prefer graphs to tables, the tabular results are depicted in the figures to the right and below the table. There is one figure with the separate Nash and Edgecombe results, and another figure with the combined results. As a rule of thumb, we prefer to use the combined results. In most cases, there was little difference in the findings between Nash and Edgecombe counties. I'm now going to transition to a screen share of the workbook where I go through the navigation we discussed. And then we'll review a few important results to see how to navigate that workbook. When you open the Community Health Survey Data Workbook, it opens to the table of contents. This is the page I went over previously, but see all the questions and the hyperlinks to each page. You can see that when you click on one of these links, it takes you to the tab of the corresponding question. Here we have question 2, asking about the importance of access to primary care. What is shown here is the tabular data and the corresponding figures. You see that the first section in the table contains the Nash and Edgecombe combined results, followed by the county-specific tables. With this data, we see that about 85% of the Twin County residents believe that access to primary care is very important. Also note that the arrow bars are on each figure. These error bars represent the 95% confidence intervals for a weighted estimate, generally meaning that if we were to repeat this for the survey, we'd expect the estimates to be within that confidence interval. Remember that these first series of questions are the Community Health Improvement Readiness questions. So this question shows the assessment of the importance of primary care. Let's now look at the community awareness of primary care options. Note that for navigation to this question, I clicked on the tab specific to question 9, and the workbook took us there. So we just saw that residents thought primary care was very important, but looking at their awareness of free or low-cost primary care options, over 50% are either not at all aware or only slightly aware of these services. This was a common finding that even for services residents thought were important, many were unaware of those services. Let's now go back to the table of contents and look at the final readiness question related to primary care. How likely residents would be to use free or low-cost primary care. You see that in both counties, more than 75% of residents indicated that they were likely or extremely likely to use free or low-cost primary care. So this was a fairly quick walkthrough of how you can go about digging into the data from the Community Health Survey, and there are plenty of more meaningful data throughout this workbook. Before we go back into the slides, I do want to show a few more helpful items. First, we have the Intro tab that provides some background of the survey, walks through the basics of the data, and covers some limitations. At the very end of the workbook, we have provided 2 appendices. Appendix 1 is a copy of the survey form. What shows up on the tab is an image of the survey, but if you double-click the tab, you will be able to open and download the survey instrument. This would be a helpful resource to assess how questions were asked to respondents. The second appendix is the demographic comparison of the Community Health Survey demographics to the U.S. Census estimates. You'll note that all demographics align, with the exception of those in red, which are subcategories of particular education and income classifications. Overall, there was very good agreement between our survey and the county estimates. So with that, I'm going to wrap up the screen sharing and transition back to the slides and turn things over to Matt Simone to walk us through the Community Health Survey data.
Great. So now we're going to talk through using the Community Health Survey data to inform community health initiatives. Let's first talk about strategies for using the data. It's critically important to understand the survey data that was collected. This goes beyond just the Community Health Survey. It's always good practice to know the context of the data and how to interpret it, and how to acknowledge any limitations of the data. Specific to the Community Health Survey data, this information is provided on the Intro tab in the workbook. The survey data can be used to provide numbers and evidence in support of current initiatives. The data provides context and firm numbers on issues in the community. Being able to cite current, valid, and reliable data is very impactful, and the Community Health Survey data provides this. Another strategy for using the data is to supplement the data with other information. While this data might be useful in providing context to a certain issue, there are likely other data points that can also be used to support initiatives. For example, the Community Health Survey measured the importance and awareness of recreational opportunities. You could then supplement that knowledge with a list of locations of parks and places to recreate to better target the need for additional parks and recreational opportunities. Let's look at these practices in more detail. In terms of the interpretations and limitations, the Community Health Survey data represents the most current, reliable, and representative data for both Nash and Edgecombe County. Because these data were collected using a validated survey method that yields reliable and representative results, we know that the data is high quality. Additionally, much of the data collected obtains information that is not otherwise collected in a regional, state, or federal surveys. It's important to remember, however, that any data collected, like the Community Health Survey, is still an estimate for the entire population. Therefore, margins of error are important to consider in evaluating data. If a non-random survey is conducted, like a convenience sample, margins of error cannot be applied and that data cannot be considered representative. Lastly, another limitation to remember is that the community survey was designed to be representative at the county level. While you can look at subpopulations within the county, you lose the precision of your estimates and the margins of error get larger. While the community health survey data is very valuable information, it's not an exhaustive resource for community information. There's a very good chance that you may need to supplement the data to really drill down on some of the key community needs for a given intervention. We earlier mentioned using secondary data to supplement, but you can also supplement the findings with additional data collection like focus groups or listening sessions. As an example, we observed in the 3Cs section that many Twin County residents believe access to worksite wellness programs is important, and many would likely use those programs. However, more than half of Twin County residents were unaware of worksite wellness programs. This finding is informative, but naturally leads to other questions. What organizations do offer worksite wellness programs? Do the major employees in the area offer worksite wellness programs? What barriers might exist that prevents them from offering these programs? These are questions that could easily be evaluated by reaching out to other community groups and maybe holding some listening sessions to find out more information. Another example of supplementing the community health survey data is pairing that data with Healthy North Carolina 2020 objectives and other secondary data. The table shown here was covered in the workgroup videos, but it matches the key quality of life community issues to various Healthy North Carolina 2020 objectives for comparison between the statewide target and current progress in Nash and Edgecombe counties. In addition to the Community Health Survey Data Workbook, there are a variety of other resources available on the partner website. The Twin Counties Healthy Living Assets and Resources map details various resources and services available to residents of the Twin Counties. The partnership website also contains a toolkit that includes public relation tools, data and communication tools, and organizational tools. And lastly, the partnership website includes a community calendar that will be managed by the partnership. This concludes the final video of the Data to Impact series. This workbook and additional background on the functions and roles of the Twin County Partnership for Healthier Communities and the work groups can be found on the partnership website. We hope you find these videos helpful, and thank you for viewing.